It is 10 o'clock and we are ready to go for the 2020 Annual Reentry Reform Day web series hosted by the Connecticut Reentry Collaborative. It's good to have everybody on the call. And again, I want to give a lot of thanks to our Central Connecticut State University IT people for setting this up and making sure that we can communicate in this time where everybody is, or almost everybody is social isolating. That's what we'll be talking about later. So Wednesday, April 15th, 2020 is a big day for the collaborative. We had been planning for this day for quite some time. What we had planned to do, though, was to be at the Capitol. This would have been our third annual day at the Capitol. We had the concourse reserved. We were going to have tables and PSAs on voting rights and talking about the state of reentry today. But that was before COVID-19 hit. And in a lot of ways, I think we all agree that this has shed a light on an issue that we think really needed a lot more attention. And so as much as this is a tragedy for many of us who have been working in the reentry field, it's also an opportunity for a larger public to be able to see, and hopefully elected officials, the value of paying attention to reentry and making sure that the 98% of people, 96 to 98% of people who are in prison and being released are being released prepared to succeed. I'm wearing my Reentry Day t-shirt. If you could see it, we would have been all in blue there. And the hashtag is dignity for all, because as we had discussed and evolved in our thinking in Connecticut in reentry planning, one of the things that we wanted to make sure is when anything is done, that dignity is at the forefront of that. And we found that approach in looking across the pond, actually, over to Europe and a lot of the systems there that are really doing a much better job at preparing people for release. And they do that because they don't have systems of perpetual punishment. And when you don't have systems of perpetual punishment, and when you focus, your main focus in the prison system and the justice system is when someone is incarcerated, that you see that the taking away of freedom as the punishment, then your main focus in that prison becomes how do people become whole people again? How do they become well, and how do they become ready to succeed and when they're released? So we want to make sure that that still is the theme of this. And what this epidemic has shown, which this pandemic has shown, is just how prepared we were for this, how prepared we are for this, and what we could be doing going forward. One of the things that we did in the last series, and we will be having two more, and we'll be talking a little bit more about the things that the Reentry Collaborative has been doing. We'll be responsive to the issue of COVID-19 and how that's impacting our prisons and justice system in general. But what's become clear in this is a pandemic is that the public health officials need to be front and center in coordinating effective release and in terms of what's happening within our prisons and the justice system in general. So we are lucky to have with us Lisa Puglisi again, Dr. Lisa Puglisi from the Transitions Clinic and Yale University. And the collaborative is no stranger to the work of the Transitions Clinic and the amazing things that they've been doing and the spotlight that they've been showing on folks reentering in terms of the health perspective, the various chronic diseases and the like that people in the justice system and prisons in particular are facing when they're released, their mortality rates, and a number of other things. So I'd love to bring on Dr. Puglisi now. She talked to us last week about the public health perspective of this pandemic in prisons, and she's going to come back and give us a little bit of an update and some more thoughts. So, Dr. Puglisi, the floor is yours.
Andrew, can you hear me okay?
Yep.
Great. So thank you for having me. I appreciate the opportunity to join you on this call. Very brief introduction to people who weren't on the call last week. I'm a primary care doctor and internist at Yale. I direct our transitions clinic there, which is a clinic entirely focused on addressing the health needs of people who are leaving correctional systems and returning to our state. And I'm leading the effort to expand transitions in Connecticut. So the statewide approach, we are also have programs in Bridgeport, at Optimus Healthcare, and at Intercommunity in Hartford, and looking to expand even beyond that. So that is the brief introduction. And to recap a couple core concepts from our discussion last week, just to frame the rest of the discussion today as well. I think it's really important that we all kind of ground ourselves in this discussion today, really focused on the fact that this is a public health crisis, period. Not a political event. It's not, really anything else than a public health crisis. So we're talking like all these conversations are squarely focused on how do we save people's lives. It is a crisis beyond anything we've seen in our lifetimes. And, I think it's core to remember that correctional health is community health. It is not a separate entity. It is not a black hole. It is not acceptable for us to not know what is going on in correctional health and to not be intimately involved in what's going on. People come in and out of our correctional facilities. Staff have lives and families and go in and out of correctional facilities. And virtually everyone who's incarcerated will return back to our communities. And so the two are inextricably linked. Again, period. So I think it's really important that we all frame this conversation around those core concepts. It's also a crisis that is asking us all to do things way beyond what we may be comfortable doing. I'm experiencing that on a personal front. I'm sure you all are as well. We're doing things we haven't had to do before in work, in our personal lives, family lives, and in our advocacy work. And so it's truly like all hands on deck. This means, in the hospital, I have never seen the sorts of things going on in the hospital that are going on now. They're building ICUs out of regular floors. We have physicians coming into practice who don't usually practice in the hospital, but just because we need them and they're dedicating themselves to it. We have nurses, janitorial staff who are working around the clock, putting their lives in danger in order to do the right thing and take care of people who are sick. And so we in the non-incarcerated, non-health sector community also have to be doing that. It's truly all hands on deck, and our correctional partners have to do that as well. I think it's really safe to say at this point that there's nothing special or unique about asking everyone to do more than they're comfortable doing. It's just what the times call for. And so this means, advocating for, changes in our correctional system that, that they may not feel comfortable making, but that the times call for. And I'll highlight some of what those are in just a moment. It also means that we in the community need to do more as well to support our community members who are being released from correctional facilities. So to update on the public health front in general, to keep everybody abreast of all the data that's come out in the week, it's really overwhelming to keep up with, actually. I will say it's a full-time job, but I've kind of boiled changes over the last week into a couple key take-home messages. As of yesterday, in our state, we had 13,989 confirmed cases of corona. That's with tests. Clearly, this is a vast underestimate of the impact of the disease in our community members, given that our testing abilities remain quite restricted. We had 1,779 people hospitalized as of yesterday. 182 incarcerated people had been infected and tested positive. That's 182 that we know of that were tested. 118 staff, correctional staff, and yesterday was reported one death of an incarcerated person. What have we learned about coronavirus in the past week that is really salient to this conversation? Number one, pre-symptomatic transmission of coronavirus is very real. It was something that we had previously discussed, we thought was happening. And for everyone on the call, that means the ability to spread the infection before you yourself, the person themselves, even knows they have it, before they feel a thing. There was a really great study published out of Singapore where they did amazing contact tracing. They had like really amazing community level contact tracing where once you become infected, they traced everybody backwards to see who they had interacted with, and then they followed those people forward. Found that on average, the pre-symptomatic spread occurred between 1 and 3 days before people knew they were sick. So that you can be spreading it for 3 days before any symptoms develop. What should we take away from that? Screening for symptoms is an inadequate mechanism for controlling the spread of coronavirus. It doesn't hurt to also do, but it is inadequate as an isolated way of tracking the disease. We've also learned, number two, that marginalized communities in general are showing very high rates of asymptomatic or pre-symptomatic infection. That means that, this data came from a study in Boston of homeless individuals that found a 36% positive rate, and these were people who had not yet developed symptoms. That's an astronomical number, and it's important to recognize because it tells us that rates in some populations, notably populations who are more likely to be incarcerated, right, are much higher than we had previously suspected. It's not shocking, but it's also like really sobering and something to really take into mind and plan around. Number three, we've seen a real disparate impact on Black and Latinx populations. This is not surprising due to many factors that we could discuss for days. You know, this is part and parcel of our system, but you know, preliminary data coming out of New York City this week showed that the virus had been twice as deadly for Black and Latinx New Yorkers. That's very sobering and something that we also need to take in mind when planning and trying to address treating COVID in Connecticut as a whole with a health equity lens. Lastly, it appears to be that this infection is spreading faster in correctional facilities than in the community. So the CDC published this week their doubling rates. It was from nationally. The average was 6 days. So that means it took 6 days to go from 5 to 10, 6 days to go from 10 to 20 cases in a population. From what we see here in Connecticut DOC, from the numbers that are now being reported on their website, it looks to be that the doubling rate is about 3 days. It could even be faster than that. I think we really don't know how many people are infected inside until we have more available testing and more broad spread, widespread testing. But this is scary, sobering, and really important for us to focus on because it brings a true sense of urgency to getting people out of our correctional facilities. So what can we do? I'm mindful of the time. I think I have another minute. What can we do? Number one is get people released. We have been saying that, really from the beginning, the core mitigation strategy is social distancing, a word most of us didn't know until 2 months ago and is now just part of the lexicon. It is one of the most effective mechanisms of prevention of illness and spread of disease. And it is impossible. We do not have correctional facilities built around social distancing. That's just not how they're designed. And so we need to get people released. Who can we release? Many groups have published on this, and there's a lot of options, right? All pretrial detainees who are found to be not at, a huge risk to the safety risk in the public. So that's most pretrial detainees. Most people who are coming up upon release in the next, let's say, 180 days to a year, and people who are already susceptible to getting worse infections. So those who are over the age of 50, those who have comorbidities, and certainly all people over the age of 65 who are at very high risk of death if they get coronavirus infection. So release. And what about for those who remain in? So, we have to really stand strong on medical isolation cannot be solitary confinement. And we need clear understanding of what's happening at Northern so that we can assure that that's not the case. There are groups that have published some really nice stuff showing what the difference is between medical isolation and solitary confinement. One is a colleague of ours out at UCSF, Bree Williams' group. And there are core sentinel concepts that need to be considered and that can help assure that being isolated in a cell is not solitary confinement. So people still need access to 1 to 2 hours of recreational time and outdoor exercise, free access to TV, tablets, whatever they have electronically, email, free daily phone calls is key to maintain connections to the community and to their loved ones. And also for peace of mind. People who are inside are worried, scared, have a lack of information, a lack of connectivity by design. And this is a scary illness for those of us in the community who have all of those things. Imagine how scary it is when you really don't. And I think we have to take that into mind. It can really negatively impact people's physical health, really their mental health, and those are both intertwined as well. We know you're more susceptible to infection under conditions of stress. So I think that this is really important for us to keep in mind. And, as of on March 20th, the DOC published a memo about the visitation, and on that they noted that Securus, which is the phone company, was offering free phone calls twice a week for 30 days. That will be coming expired in a couple of days. I think we need to be advocating that Securus A, extend this, and B, that it be daily free phone calls. Twice a week during a pandemic is a nice touch, but not enough. We need more connectivity for people who are incarcerated and their loved ones in the community who are worried sick about them. And then lastly, we need an extremely robust community response. That means we all have to do things, again, we're not comfortable doing. People are going to be being released and we have to be ready for them. So they're going to be coming out to a very scary world with very few options. And so we need to be able to supply phones for everybody, personal care supplies, housing, whether that's hoteling. The CT Coalition to End Homelessness is doing amazing work around this, and we need to do more. So this is stuff like creativity that we haven't had to call upon recently, but that has been used since the beginning of time. How can we house people? How can our places of worship, sponsor people? How can we get people to volunteer to sponsor people in their homes or in their extra rooms or any space they may have that's livable? And we in the healthcare sector are trying to do our part and have to do more. As I mentioned last week, we have a hotline set up so that anybody who's coming out who has any health problem, Transitions Clinic will help deal with it so that that part does not go unmet. Those needs do not go unmet. But on the reentry organization level as well, it's, we may have rules against kind of seeing people in person, but we have to sometimes break those rules. Like people who have complex lives and complex medical issues going on really often need to be seen in person. It's hard to just do that all over the phone. So if the, city hall is shut down, sometimes it might mean opening it up for a couple hours to welcome people home who are going to need a lot of resources. I think I'll pause there so that I don't take up too much time, and I'm happy for questions later.
Yeah, thank you, Lisa. I really appreciate that and appreciate your perspective. I think it's helpful for people to know what's happening in the general medical community and public health community, but then that intersection with the prison population and the justice community. So thank you so much for taking your time. And I know you have to be off by 11 because I believe you're going back on the floor then in the clinic. So I do have one question for you, and that is, what is the medical recommendation regarding new admissions to halfway houses? Should that be stalled and the population thinned to help minimize the number of new COVID cases in the halfway houses?
Complex issue, because certainly, for in some situations, the DOC needs somewhere to put people in order to get them out of our correctional facilities where they're at most risk. But I'll also say our halfway houses themselves pose a unique risk given the density of people staying in them. And so it does seem the safest at this time to really be limiting new admissions to halfway houses and getting people out of halfway houses as well to allow for more social distancing in them. And so we need to get creative around other solutions to housing people that's not halfway houses. Many people in halfway houses have places that they could go. And so we need to, really advocate for using that avenue as an alternative.
Thank you so much. And we'll talk about that a little bit later as well, because I do want to mention to folks that the agenda has shifted a little bit as we've tried to be responsive to the times. You may not have the most up-to-date agenda. We're going to move now to Sarah Russell and session 1, which is managing the criminal justice system in a public health pandemic. Lisa, we'd love you to stay on for this conversation, which we're looking to wrap up by 11. And along with Sarah and after Sarah, we'll talk about the municipal responses for reentry needs. And we have Earl Bloodworth, who directs the Mayor's Initiative for Reentry Affairs of the City of Bridgeport, Carlos Sosa Lombardo, Project Fresh Start Director of the City of New Haven, and Heather Francisco, who co-chairs the Greater Waterbury Reentry Council, all members of the Reentry Collaborative. And then at 11, we're going to session 2, which we're titling COVID Hits Home. And that's when Daryl McGraw, the collaborative and the IMRP's reentry policy specialist, who was on last week, is going to be moderating along and has guests Deb Martinez and Crystal Burns, who are both impacted family members and advocates, and Kevin Ogman, who was a recently released returning citizen. And then we have next steps and a call to action. And just so folks know, we may be joined, and we're hoping to be joined by members of the Legislative Black and Puerto Rican Caucus, who at 10 a.m. have a call with the governor. And one of the things that they are talking about with him right now is the response to prisons. And I know the House Democratic Caucus had a call with Commissioner Cook yesterday about that as well. So it is on the minds front and center of a lot of legislators. And I know, Lisa, you mentioned the disparate impact on Black and Latinx. And so it is really a concern for the caucus. So we're hoping to have them later. And this is what the time last week that we brought on Mike Lawler. And I'll just let you know that the video of that is on our Facebook page, the IMRP's Facebook page, which we can share after this. And there's also more information on this session and resources on the ctreentry.org site. So now we'll move on to managing the justice system in a public health pandemic, because As Dr. Puglisi mentioned, and I think as a lot of people have been advocating for, there's a suit the ACLU put in towards the state in terms of releasing more people. And what Sarah is going to do for us is give us a broad overview of what other states have done. And so, Sarah, I'd like to bring you on now.
Thanks. Can you hear me?
Yep.
All right. So I want to just summarize actions in states nationwide relating to the release of incarcerated individuals in light of COVID-19. And I do want to stress that although there have been positive steps taken in some states around the country, really none of these actions have been as bold as what's needed to address this public health crisis. So nonetheless, I do think there are some examples that are useful for us to look at here in Connecticut. When we look at actions in other states, it's helpful to keep in mind the different categories of people who are incarcerated. So there are people detained pretrial who are facing criminal charges, people serving sentences for offenses, and then people detained who are awaiting probation violation hearings or parole revocation hearings, and then those who are actually serving sentences for those violations. And when you look at state actions, there are also a range of decision makers that you're seeing around the country. So you see governors acting, commissioners of corrections, head of parole boards, judges, prosecutors, and others. Starting briefly with respect to the pretrial population, there are lots of examples of releases going on at the local level. You see some statewide action being taken. So for example, recently the Massachusetts Supreme Judicial Court, which is Massachusetts' highest court, ordered that people held pretrial on bail are entitled to a hearing within 2 days of filing a motion for release. A special master has been appointed to facilitate those hearings in a centralized way. There are some categories of offenses excluded, but that is an example of a statewide process that has been established to expedite the consideration of those detained pretrial. With respect to sentenced people, last Friday, the governors of New Jersey and Pennsylvania both signed executive orders establishing a process to provide temporary home confinement for some categories of incarcerated individuals. So in New Jersey, the mechanism for temporary release is through the DOC's commissioner's furlough power. In Pennsylvania, the governor is using his reprieve power. And these programs have somewhat different criteria, but both are focused on individuals who are particularly vulnerable to the virus, as well as those relatively close to the end of their sentences. Illinois' governor also recently expanded the Department of Corrections commissioners of furlough authority in that state. So the idea here with these 3 examples is essentially to pause the sentence and allow the person to be confined at home, at least for a period rather than in prison. In Connecticut, we could do the same. Our DOC commissioner has furlough power under state statute and can temporarily release people in prison to home confinement or other settings. Our governor also has the power under the state constitution to temporarily release prisoners by granting reprieves of sentences. By way of other examples, governors in Oklahoma, Kentucky, and Washington have commuted the sentences of a number of prisoners. So they're close to 500 people recently in Oklahoma with sentences commuted, and close to 1,000 in both Kentucky and Washington state recently. Here in Connecticut, our Board of Pardons and Paroles has the power to commute sentences and thus release sentenced people in that manner. Another example comes from Colorado, where the governor has suspended the statutory criteria in that state for compassionate parole release. And that in Colorado, the governor gave the Department of Corrections the ability to identify interim criteria to address this particular process and refer those people to the parole board. Here in Connecticut, our governor, in light of this public health crisis, could expand the criteria that our Board of Pardons and Parole uses in considering requests for compassionate release parole. And an example comes, as I said, from Colorado on that front. Some state parole boards nationwide have expedited parole consideration of cases, and some states have moved up parole eligibility dates. Some boards are also expediting consideration of commutation requests. We see also in some states around the country that there have been established centralized processes for courts to consider sentence modifications in some categories of cases on an expedited process. So rather than just relying on individuals to file these requests, there's a process of looking at categories of cases to have expedited consideration of modification. Here in Connecticut, under existing law, judges have the authority to modify sentences of less than 3 years without the consent of the prosecutor, and can modify longer sentences with prosecutorial consent. Finally, on the federal level, the recent act from Congress, the CARES Act, greatly expands the authority of the Federal Bureau of Prisons to place incarcerated people on home confinement during this crisis. The Attorney General Barr has directed the Bureau of Prisons to expedite consideration of home confinement, particularly in those facilities with the largest outbreaks. FCI Danbury here in Connecticut is one example of one of the federal facilities hit hardest. Though we're not seeing kind of movement of people to home confinement that is really necessary at this point. So those are examples from around the country of different decision makers working to release individuals to respond to the crisis. I do want to return to sort of a point that Mike Lawler made, I think, in his closing remarks last week, which was really that the focus should be on whether someone needs to be incarcerated for public safety reasons, not whether they deserve to be incarcerated. And under existing Connecticut law, the governor and the DOC commissioner can temporarily place incarcerated individuals on home confinement during this crisis. Such an action does not require undoing the sentence or changing the sentence. And it's really a decision that can be guided and needs to be guided by public health goals, not traditional criminal justice goals related to punishment. As others have stressed, everyone in the state has an interest in minimizing the spread of this virus in the prisons. And then finally, I know this will be the focus of many other remarks today, but we really cannot have release without resources provided for reentry, both planning and support for people when they get home. So the two obviously need to go hand in hand.
Thank you so much, Professor Russell. And I know we shared the memo which outlines all of the information, or not even more of the information that you provided just now for us in a memo dated April 13 from the Civil Justice Clinic at Quinnipiac Law. And I believe the Sentencing Commission is going to be meeting this Friday at 2 p.m. virtually. And most likely we'll have a lot of the folks from the system there giving updates on what's happening and discussing what the commission can do. So I want to thank you for that. I also want to go back to what you said and what Lisa said about what's needed, and about, in particular, Dr. Puglisi, about feeling comfortable. And, you know, the Reentry Collaborative in 2018, prior to the new administration coming on, had worked with the previous administration, Mike Lawler and others. Governor Malloy was a part of the conversation to create the reentry strategy. And I don't know if people are aware, but in 2006, when the Sentencing Commission or Task Force was created, which became the commission, and Mark Pelka's current position, the Undersecretary for Public Planning, for Criminal Justice Policy and Planning Division, was created. One of the things that was a part of that statutory requirement is a reentry strategy, an annual reentry strategy. And the collaborative wanted that document And so we took it on to ask that it could be produced and that we would be partners because we weren't sure who the new governor was going to be and if they would be as attentive to the criminal justice system as Governor Malloy had been. We also thought it was really important to map out what is our reentry strategy in a time when we knew that 50% to 60% of the people were going to be back in prison within 3 years. And that just wasn't and shouldn't be okay by the justice system or the public by any standard. And so what that reentry strategy does, as well as that position within OPM, makes it so that this is a system-wide response, not any particular actor within the system, like the Department of Corrections. And I did note in the one public event that I think the governor has had, and I don't think there's been any executive orders addressing the criminal justice system, but it was Commissioner Cook of the prison system, the correction system that was there. This is a justice system. This is not just a corrections commissioner. This is also the judicial system. This is the Board of Pardons and Parole. And as Dr. Puglisi noted, this is also public health officials that need to be a part of the response. And I think part of the concern is the sense that there isn't a sense within the administration of what is actually needed and what is made up in this system in order to fully address it head on. And the reentry strategy that we did create is on ctreentry.org. And I know Brittany's been sharing in the chat some links there in terms of reentry.org and things that you can find that might be useful to you as you look at this. And know that the collaborative is going to continue to push. One of the things that we wanted to create in the new system was a reentry czar, someone who actually has control over the reentry policy making in the state, and not necessarily, and actually not involved with whether or not someone is committing a crime. Public safety is imperative, of course, but someone focusing on reentry should not necessarily be concerned about whether or not that person is committing a crime. They should be concerned about how does that person succeed. And I know these are the things that the next panelists will talk about. And so I'd like to bring on, and they were highlighted in an article that we shared, written by Lisa Backus, Earl Bloodworth, and Carlos, the city reentry directors for Bridgeport and New Haven, as well as Heather Francisco from Waterbury and the Waterbury Reentry Council, because I know, Earl and Carlos, you deal day to day with people calling your office saying what can be done. And the Reentry Collaborative has been working with the Department of Correction on the end of sentence population. The end of sentence population in the major cities runs about 30 people per month. Coming back to the cities. And so it's not insubstantial, the number of people coming back. And as we found, it's been highlighted in this crisis, a number of them are being released homeless. And so, we have not just the end of sentence population, but I know we've had experiences with people being released pretrial potentially into homelessness as well. So I'd like to bring in that perspective, because ultimately it is the community that is receiving people from the department, and which is why the community needs to be a part of the response. And so, Carlos, maybe you can start with what you're experiencing in New Haven. And some thoughts on people being released, what's happening now, what could happen, and what should happen if the system were to be truly responsive to the amounts of people being released that are being argued for currently on this call.
Okay, can you hear me?
Yep.
Okay, beautiful. Thank you, Andrew, for the introduction. It's a pleasure to be here. And one of the biggest challenges right now, as you stated, is supporting our returning residents who will be homeless upon release. The Department of Corrections have been really great about it. They are helping out through a new program in coordination with the Connecticut Coalition to End Homelessness and the CAN of Greater New Haven. They are providing support to people who are returning home. They're doing homeless prevention through a rapid rehousing program. As of right now and up until May 2nd, we are projecting to receive about 10 returning residents who will be homeless. So as of right now, it's pretty manageable. We are trying to complement that program with case management supports. I'm currently working to secure some funding for an essential service that returning residents need. Case management is the cornerstone of successful reentry. So we are very mindful of not only providing housing for people who are returning homeless, but also to providing the supports that they need to be successful and be able to achieve self-sustainability. Yeah, that's what we are working right now. Hopefully, we can put systems in place that will be sustained even after a pandemic is done. I just find it unfortunate that a pandemic had to come about to put on systems like this. And my hope is that we can really sustain these type of programs over the long term and help out people even after the pandemic is done.
Thank you, Carlos. And I know that's one of the things that we've been working with. And we had Beth and Sue on from Hartford talking about the Reentry Center, is creating reentry centers in Bridgeport, potentially in New Haven, as well as Stanford. We know that Waterbury is on the verge of having a full-scale reentry center as well. And this would allow one-stop I don't want to say shopping, but this is one-stop location where people can come back and really get all those needs addressed. But one of the things that you mentioned was the case planning, and so this is reaching in 6 months ahead of time at the very least, and making sure that the reentry center isn't dealing with someone being released homeless. That has been addressed ahead of time. That people are connected with family. That family knows what's happening with that individual coming out. Potentially they're set up to work, that they have their public health concerns addressed. And so, Earl, I'd love to bring you into the conversation now and talk about what you're seeing in Bridgeport, the needs that you're able to address, and some of the things that you think could be augmented potentially to be able to really ensure success.
Thank you, Andrew. Good morning, everybody. Thanks for having me on. I mean, to echo some of what Carlos said, it's unfortunate that a pandemic had to expose all of these gaps in the system, especially in the urban areas. Between from what Dr. Puglisi was saying, how the virus is spread, like wildfire, or can easily spread like wildfire in the prisons, to a lot of the reports that came out last week about how the virus spreads in the urban community. I say all that to say that in the best of times, it's hard to get these resources together for individuals that are coming out. So you can imagine how it is right now trying to get resources for individuals that are returning to our communities, whether that be Bridgeport, Hartford, or New Haven. I think with what Sue and Hartford has going on with the Reentry Center, that's very helpful. I know here in Bridgeport, and as you said, in New Haven, we're looking to try to formulate some kind of plan to create a reentry center in our cities, and mainly beginning to focus on the end of sentence, because those are the hardest kind of hit, coming out, as we find now, homeless or with very little continuity of care, which is very important in communicating that with the health agencies that are available, like Transitions Clinic. But it's a hard nut to crack overall. The community is important in doing the work like we've been doing for a very long time, and many people before myself, but more specifically recently with us working on the Connecticut State Reentry Strategy, making these connections with Connecticut Coalition to End Homelessness, It's really just trying to knit together all of these resources statewide, collaboratively, and then also locally with the municipalities, and making sure that that communication and transparency is in partnership is going full bore with the Department of Corrections. Specifically in Bridgeport, I mean, there have been a couple of articles. There's going to be, from my understanding, a protest later today in Bridgeport at 3 o'clock in front of the county jail in Bridgeport. There was an article that just came out in regards to an individual that was 60 plus years old and trying to return to Bridgeport. Had met the criteria for the early release, had a pre-existing condition, but unfortunately, like many other people in this pandemic, this individual passed away, and that was due to circumstances that couldn't necessarily be controlled. He had family members that were willing to take him in, but they didn't necessarily meet the criteria for sponsorship. So when we talk about people needing places to go or having a safe place to go for this population, it's critical. I know also recently, along with the individuals that kind of meet the criteria for the early release, you had the judicial, as you said, it's a system. You had the judicial department working to have people released promise to appear. And what we found out with some of these individuals were releasing promise to appear, but they were releasing homeless. So it's been a great concerted effort working with the Coalition to End Homelessness to try to find places for these individuals to go, if not temporarily through like rapid rehousing. But again, that's only a temporary stopgap measure. If they're going to put them up in a hotel because they can't go to the shelters, because either the shelters are at capacity or they're trying to decrease the amount of population in the shelters so they can have room to isolate people if they come down with the virus, if they contract the virus. So you just got a lot of different moving parts in all the major major urban areas that were already under pressure pre-COVID-19, and now you can see expressly in the communities that are hardest hit. So it's a Herculean effort to try to make sure that people's safety is taken into account. Like Dr. Pugliese stressed, this is really a public safety and public health issue that needs to be addressed. So if we can find ways to shelter people with family members, or find ways to have some of the Section 8 laws kind of amended so individuals can kind of reunify with their families in Section 8 or public housing. Those would be great alternatives, but we're not there yet, unfortunately, in the state of Connecticut.
Right. Thank you so much, Earl. And I just want to mention there's a question about how do we make sure that people are released not just safely to themselves but others, because of a concern that they may do harm to others by virtue of the fact that they're in prison in the first place, and that they may go back to criminal activity. And I mean, I think in my mind, and I'd like to bring in Heather here too, is I don't think anyone in our position in the community, in the collaborative, thinks that, and I hear you echoing it, Earl and Carlos, that we have enough, that the community response is enough. I think we have been ramping up the fact that there are actually positions in communities in the major municipalities of reentry directors, as I mentioned on the last call, is a fairly new phenomenon. A lot of people would like to put blame on the justice system, on police, on others for the situation that we're in terms of mass incarceration and the like. But the issue with that has been the majority population has agreed with that. The voting population has agreed with that. They have created that system and given people the license that is okay. I think what we've been pushing for and what we've seen in incremental change is that that's not okay, and that the community has to be a part of the solution. But I don't think anyone's feeling that we're fully to where we want to be. And I think we'll have more of that conversation later in the month. As the month goes, we may even have a prison official from Norway on, just to give a sense of what is possible. Because when you look across this country, as Sarah was mentioning, things are happening, but they're really not as bold as they could be. And people need to step up. The fellow that passed away, in prison, he was looking for a sponsor. The question, who is going to be that sponsor? Who is going to provide that place if it's not his family, or if he doesn't have a halfway house or somewhere to go? Because there are plenty of people in prison who are ready to go but don't have a sponsor, and that's, as much up to the community to figure that out in concert with the system. So I'd like to bring in Heather, because we've mentioned talking with end of sentence, and Earl, you referenced a pretrial release, and that's one of the biggest populations that could be released. But how do we make sure that they're released safely? And Heather, I know you have a particular case there where it happened in Waterbury. And also, I'd love to hear about the Reentry Center and your plans in working with the roundtable there.
Hi, thank you. Can you all hear me?
Yes.
Okay, wonderful. So my name is Heather, and I am the co-chair for the Greater Waterbury Reentry Council, and I came into that role through my position at Safe Haven of Greater Waterbury. We are the local sexual assault and domestic violence crisis service provider. If there are any survivors out there today, I want you to know that we are still here for you, and we believe you. I want to thank everyone today for the opportunity to talk about my community and our needs. I'd like to start by just saying that the Greater Waterbury Reentry Council truly appreciates our many local, state, and federal partners. Together, we really do great work. We cannot do this work alone. To do this work, we do need open, honest, and collaborative conversations. We need this now more than ever. We need to assure that those discharging during COVID have access to resources. In the cases I'm going to share with you today, really underscore this need. Twice in the past week, Waterbury has welcomed individuals discharged from incarceration to homelessness. In both these cases, a breakdown in communication complicated this process. I think I can thank my fellow panelist, Earl. Thank you, Earl, for your support with the first case I'd like to talk briefly about. This individual was given a PTA, a promise to appear at a bond hearing in another community, not even in Waterbury. But being from Waterbury, this individual wanted to return to our community. They were ultimately connected with resources, and they have joined our community, but this process was not without its complications, and those complications are directly due to COVID-19 in this pandemic. The second case I'd like to talk briefly about is a case that by all accounts was really progressing as anyone could expect or hope for. Our CAN, our Coordinated Access Network, was receiving advance notice of an individual being discharged to homelessness. All necessary steps were taken, and space was to be ready and available for this individual. What happened was the discharge fell on a holiday weekend. This individual was discharged a few days early, and this was easily overcome. I want to give a lot of credit to our local providers because they were able to overcome that very quickly and very easily. What was harder to overcome was the fact that the individual was symptomatic and had received COVID-19 testing prior to being dropped off, yet no one at the location welcoming this individual was notified of this. In fact, it would be nearly 2 days before they learned that the individual had in fact tested positive for COVID-19. Waterbury is prepared to welcome individuals who are symptomatic, even those who have tested positive. However, we need to know in advance whenever possible so that we can assure those individuals are receiving proper supports, so that we can assure once they arrive that the community members who are working to serve this population on the front lines are protected when providing those vital services. These cases really highlight the need for Waterbury to have a reentry center with a solid infrastructure. Currently, our center is closed due to the lack thereof. We do the best we can with what we have. In pre-COVID, the center was operational. We are working hard to establish a more independently structured welcome center here in Waterbury, but COVID-19 has really put a damper on that. We are progressing along. We will press on, and we do hope with the city's support that we can have a fully functional reentry welcome center sometime next year. But it would really be beneficial if we had that now. I think a lot of these barriers would have been much easily overcome had we had that already in place.
Thank you so much, Heather. I really appreciate that. And this is for the three of you. There's a question about individuals convicted of sexual offenses and how they're being handled in release. And I know end of sentence doesn't discriminate. When you're being released end of sentence, you're end of sentence. The state has no more purview over you. So what happens there is, you know, there isn't a discretion to not release somebody, but there's also people accused of it, as well as folks being released to parole. I don't know if any of you have any particular instances that you'd like to share with that, or general thoughts.
Andrew, I just want to take a back step and do a reflection, right? A lot of the issues that we have right now during the pandemic come about pre-pandemic, and it's mainly not because of the lack of support from the community. I mean, the community, I think, really wants to provide opportunities to people who are returning home. The main issue is the lack of resources. I mean, the state is not investing in reentry. It's not providing money for reentry. It's not funding reentry centers, and we have to scramble around for funding. Just to, I myself operate a research center, and I'm the only full-time staff. Last year alone, I helped out more than 1,200 people. And without any state resources whatsoever, and local resources are not enough, it has been historical that in New Haven, people from other towns are released because of services, and these other towns are not stepping up either to provide resources for the formerly incarcerated who are returning to New Haven. And I think that one of the biggest things that the community can do, besides asking that people are released, is also advocating for funding for reentry. I mean, people are gonna come home, but come home to what? Especially now during the pandemic, that many service providers are unable to provide services due to the nature of their services, right? And that includes sexual offenders, include people who need treatment, include people who need systems in place to be supported for long-term successful reentry. One of the little things that the state can do right now is at least start activating SNAP cards pre-release along with the medical cards. Start activating SSDI along with the Husky medical card, and have people come out with those social supports that can help them at least get by during the few months that they are released, along with other supports that probably they have from their family members and from other resources in the community. Other challenges that I see right now is that many providers are launching online systems, but many people coming home, they do not have cell phones, they do not have computers. How are they going to take advantage of these services if they cannot even access it? They cannot go in person right now to many of these service providers. So one of the biggest things, I think, along with the SNAP card activation, the SSDI activation pre-release, I believe the formerly incarcerated should be getting cell phones before being released. And we have the state lifetime program that provides free cell phones to any person who has SNAP cards. So, activating that SNAP card pre-release can really help that person access a phone, at least by the time they're released. Other things that we have to take in mind is, again, we are asking for people to be released, but be released to what? We need resources for reentry. We need the state to step in and start providing resources to the cities where people are returning. And yeah, that's my 2 cents on these, all of these, Andrew. And I probably not directly answered the question, but the question is related to all of these lack of resources.
Yeah, no, I think, Carlos, you're spot on. And in terms of the perspective of the collaborative, the perspective of the system, and I mentioned the creation of positions, the sentencing commission, that was all started when the state was the first in the nation to enact justice reinvestment legislation. The whole premise of justice reinvestment is that you take an over-incarcerated population and you effectively manage that down. So you place those resources that are saved into the community, so you stop that cycle. And I think you're noting something that's extremely important is, to date, those resources have not been placed anywhere outside of the justice system. They haven't placed directly in the community to support things like reentry centers in the city of Bridgeport and New Haven and others. You've been left scrambling to get dollars here and there. And you know, the fact of the matter is, we're in a pandemic, and people, I think, are scrambling to say what needs to be done now in terms of managing populations. But frankly, you know, there's a resource conversation that should be had as well. You know, there's the people are being placed up in Northern. There was a conversation in the legislature prior to this about closing Northern. We don't necessarily even need that facility to exist. The prison population is declining. If people were being released safely and they were being dealt with safely, and those resources are being placed out into the community, that's the exact path that we were on. This pandemic actually provides that opportunity to keep that going in a way that's manageable, that's better long-term for the state versus going backwards. So I think you're highlighting something that's really important for people to consider. I know we have Representative Robin Porter has joined on. I believe we'll have more. I'd like to end this section now at 11 o'clock, and we're going to move on to Daryl McGraw and his panel. And Daryl, I know you've been, I'm just pulling up my agenda here. One thing I want to do is give a shout out. It's his birthday today. And we've been so appreciative of Daryl's perspective on reentry, because the types of things that he's talking about in the conversations that we've been having, frankly, are things that I hadn't considered sometimes. And, you know, that's that lived experience perspective, that the whole thing about, well, if someone's being transferred to Northern, which you brought up the other day, and you're sick, who in the system is going to act or tell people that they're sick? No one wants to go to Northern, right, Daryl? So let's bring in the COVID hits home moderated discussion by Daryl. I'll hand the mic over to you, Daryl. You can introduce folks. And we do have some legislators coming in, and hopefully if they can chat us with some questions, and then we can bring them on into that conversation. But I'll let you start. And Daryl, you have till, as I mentioned, we're going a little longer today because we have a packed panel. This is all recorded if people have to jump off, but this is a conversation that we feel we need to have, and we're not going to necessarily be limited by the time that we had initially anticipated. So Daryl, the floor is yours.
Hello, everyone. Can you hear me? Can you guys hear me? Yay, nay. So thank you, Andrew. Thank you for the birthday shout out. You know, I'm happy to be turning 21 today. You know, I'm finally legal, so I'm excited about that. So I want to introduce, first I want to thank everybody that joined us on this web series. You know, this is an important topic, and I appreciate everyone joining us and following along. I really appreciate Dr. Puglisi and everyone else, that all the previous panelists, Heather, Earl, Carlos, you know, and those people that have come, Sarah, you know, for giving their expertise, because this is important. We don't want to just have a one-sided conversation. We want to have a full conversation with everyone at the table. And that's why I'm excited to have my guests, Deb Martinez, Crystal Burns, both who have family members that are currently incarcerated, to be on this call and have them join me, as well as a brother Kevin Augman, who just was recently released within a week of just getting out. So imagine being released. And, you know, those of you that know my story know that I spent 10 years of my life in and out of the Department of Corrections. And, you know, one of the things that, you know, is, you know, our worst nightmare has happened. You know, a brother has died behind bars due to COVID. And that's crazy, because, you know, one of the things, having been incarcerated and having been in a cell And, you know, there's two things that we think about constantly. Are we going to make it out of this situation? You know, one of my biggest fears of being incarcerated was, you know, dying while in jail, you know. And then the second one is, or losing a family member while incarcerated. These are thoughts that go through people's minds on a regular basis. So to have a 2-year sentence and have that 1 year in, be eligible, could make it out, and nobody sponsor that individual at 60 years old, and that 2-year sentence turned into a life bid. That's unacceptable. And we as reentry people, reentry folks, as community members, we can no longer, we can't sit by and just let something like that happen. We're not pointing a finger at DOC. We're not pointing a finger at anybody. We're just saying that we need to do better. People shouldn't have to die behind bars. I really appreciate a lot of the information that Sarah provided us, because she did not just come with problems, she also came with solutions. She said these things are possible. So when we're advocating, you know, and shout out to my advocates that are on the phone, I see many of you there, but we need to start focusing on what our ask is. What are we asking for? I love the honking in front of the governor's house, and we're talking mass release. As Carlos said, we can't release people without resources. What are our asks? You know, there are different vessels that people can be released, so we need to make sure that we're focusing on the proper language and asking those, you know, and making sure our ask is right. I could talk all day, but I would like to, Deb, are you there?
Yep, I'm here.
Hey, what's up? How you doing, Deb?
I'm doing good. Thanks for having me today.
Good. Is Crystal on the line? How about Cav? Cav, you there?
Hi, it's Crystal. I'm here as well.
Hey, Crystal, how you doing?
Good, and you?
Good. And Cav, are you there? We'll get back to Cav. I know that he was there. Hey, Deb, I see you now. So just like, let's get our call started. How's it going, Deb? What are you hearing? I know that you're an advocate. You know, we talk a lot. We have some of the, you know, some mutual friends. What are you hearing from behind the wall? You want to talk about some of that stuff? Like, what's going on? Because there's a lot of stuff being said. Tell us what you're actually hearing from your family members. What's it like being a family member on this side?
So what I could say is, my specific family member is over at Cheshire in between North 5 and North 6. And coming out of that unit, everything is positive with respect to what's happening. So we have, you know, they've said the officers have been communicating with them really well. They encourage cleaning. They're cleaning the bubble. Every shift, they're providing the guys with supplies, with gloves. We all know the masks aren't the greatest thing that were handed out. However, those were handed out to officers and to residents. So positive things with respect to the administration. I know that the warden over there actually toured on Saturday, which stood out to me because not only was it a Saturday, but it was a holiday weekend. And so I think the fact that he is present and people are seeing him over there is making a difference for some of these guys. You know, he's answering questions. It's my understanding when they ask, which is what they want, right? It's what we all want. We want transparency. We just want some understanding and some honesty, because a lot of times we're all reacting from a place of fear right now. At the same time, I think the fact that they're still getting their rec is really important. These phone calls are really important, the connection to home, because that's where they start to get inside their head and start thinking. You know, my brother said something really tough to me last night. He said, Debbie, there's a poisonous gas leaking in your house, and I just want you to put a cover over your face. You'll be okay. And he said, that's where we're at. We're scared. And we just want to know what steps are being taken to keep us safe. And do any of us qualify? Now, maybe are there exceptions? Can we look at what the criteria to be furloughed or discharged looks like and expand that? Overall, within that unit, things are positive. I know that I've talked to other family members in other facilities that are having a slightly different experience, but for the most part, over there. They're doing well and just really focusing on their mental health and keeping the guys busy. We did unfortunately have someone in the unit who had a loved one pass away. Again, I was able to reach out to that warden who responded within minutes and took care of that. So I was really glad to hear those things.
Did your loved one talk about about people getting sick? And I know Andrew mentioned it, and just the thought of going to Northern because I'm sick. You know I wouldn't cough around anyone if I would even sneeze at that point. How are they talking about that? Is that in the rumor mill behind the wall?
Yeah, so that's a definite conversation. So I'll start by saying that my brother spent 5.5 years at Northern. So I'm well versed on that particular building with a lot of experience over there. So there's been, conversations about people are scared to say that they don't feel good or that they think they might be coming down with something, and not necessarily because they're scared of how the department's going to react to them. I think it's the unknowing. People just feel like they don't have the information. Like, well, if I say that I don't feel good, what's the next step?
Right.
So, and Northern, you're right. Northern is, when I first heard they were transporting people to Northern, I will tell you, like, I cringed because it has never been known for being a place that anyone wants to be.
Right. Yeah. Hey, Crystal, are you on? What are you hearing from your loved one?
Hey. So I'm hearing similar things to Deb, where there is a big concern about the information that they're receiving, how often the information is being provided, the accuracy of the information. So it kind of starts the rumor mill with inside, where they tend to mix the information up or heighten the concern. So there's the opportunity there for me to inform my loved one that there are things you can do to help protect yourself, as far as washing your hands, as far as not touching your face, trying to keep the distance where you have the availability to do so. I know that there is some situations where they are just very closely put together. So there isn't that room to be able to space yourself the 6 feet distance. So just kind of informing my loved one that, okay, so there are things you can do. You can face in the opposite direction if you're using the phone and it's full where a whole bunch of guys are on at the same time. Just little things that I can kind of enforce and help them understand. But there is a concern that the virus is within the system, and it's this COs as well as the inmates that could be carrying, and just what happens if I get sick. And similar to what Deb said, there's also that concern that if I get sick, they're going to pull me over to Northern, and how are you going to know how I'm doing? How am I going to be able to get in contact with you? Who's going to check on me to make sure that I'm being taken care of? So there is a lot of concern there, that they're being protected and they're being considered in this whole pandemic, and that they're just not being left behind.
Right. I appreciate that, because we do have legislators on the call, and I know that it's very valuable information. So when they start to make their requests, I know that Robin Porter's on the call, and I know one of her requests was to make sure that we get eyes on some of these guys that are being shipped to Northern and finding out how they're being treated. So I'm excited to hear from her later in the conversation. Hey, Kev, did you make it on the call yet? Kev? You might be on mute. Brittany, is my friend on mute? I know he said he was listening. If not, Kev, try to call back. We would love to hear from you. And anybody else that's on the call that was recently released, I would like to say at this time, welcome home. Welcome home. Anytime that we got somebody that's being released and comes before you, make sure that you say welcome home. That's the most nicest thing that you could say to an individual being released from prison.
Hey, Daryl?
Yes, sir.
Just a quick note. I had a couple of people too that had reached out that wanted to get a chance to speak. One is a recent released person, and another person from Bridgeport that has family members that are currently incarcerated.
Okay. Earl, is that person on the call right now, Earl?
Yeah. I have Samaris Rose with family members that are currently incarcerated, and then also we have Mr. Tito Negron. He had issues getting in, so he signed in under Jerry Smart.
Okay.
Wait, hi, this is Brittany. Hold on, let me see if I can find him, Earl. You said under Jerry with a J?
Yeah.
Yeah, Earl, we can't have people coming in under aliases, especially Tito Negron, man. I don't know if we're going, that's my guy. Hey,
And who was the other one, Earl? I just added Jerry.
Samaris.
Go ahead, Earl. I'm sorry.
Samaris Rose.
How do I spell Samaris?
I'll tell you just one moment.
Hey, while we're doing that, Crystal or Deb, are you getting the 2 phone calls a week? How's that phone call thing working out? What are brothers saying, and what are your loved ones saying about the phone call situation? Is that working out?
Go ahead, Crystal.
Oh, okay, Deb, thanks. I was just gonna say we are getting the 2 phone calls a week. I can say the response is good that we are getting the 2 phone calls. I think that was a great start. I do think that the 2 phone calls is a little less than what would be preferred, just because there is that sense to want to check in at least on a daily, other day basis.
Right.
I can say that my worry comes when I haven't heard from my loved one, because I don't know how soon, if he is becomes symptomatic or he's transferred to another unit, another facility because he becomes positive. How soon am I going to get that notification? So I definitely look for that daily, other day check-in. But I do think the 2 calls are good, very much appreciated. But I think I would like to see that increased a little bit.
I appreciate that, Crystal. I mean, that's a good point that we should be taking a note on the fact that how's that being handled? If somebody is identified as positive, are they being transferred? Do they still have access to calls? We need to be finding that out. And if someone does get transferred, I know that, I am being incarcerated and I was transferred and my loved one came to a visit. They didn't know that I got transferred. And sometimes, so that's one of the worst situations to have somebody, I know we had on our call line, we had a mom who said that they were getting regular calls and then, the system was down and then they didn't have that. So communication and transparency is very key. I really appreciate that part of you saying that, Crystal. I really appreciate that. Hey, Tino, are you on the line? Tino, is Tino, AKA Jerry Smart, there? Deb, how about you with the calls?
So we are definitely getting the phone calls.
Hey, we got two of you going.
Everyone please mute their mics if they are not speaking.
Thank you, Brittany. Brittany is like the overlord.
Happy birthday.
Hey, thank you. Thank you. I want cake. Go ahead, Deb.
I am getting the 2 phone. I actually speak to my brother a lot. I speak to my brother a lot on a daily basis. We tend to sort of be the exception to the rule. But the 2 phone calls ironically come in every Saturday morning, which has been good. It's been really positive. I will say in one way that I have found, we have a family support group, and ways that we as family members can support our loved ones and other loved ones is within our group. What we do is we share information. So within those like 2 units, if I have another loved one will text me and say, hey, I haven't heard from my son. He used his 2 phone calls. Can you check? Can you see? Right. So sort of supporting each other, not only the guys supporting each other in there, but us supporting them. And I'll say to my brother, hey, can you check in on so-and-so and get back to me? And he'll let me know, yeah, he's fine. Or when someone's transferred, just when you have that support and sort of create a network with each other, then it's a way to get more, to have more communication just another layer of well, the Department of Corrections is, working to figure out how to get everything going.
I appreciate that, Deb. A lot of our people are asking in the chat box if you could in the chat box or share, we'll definitely share your information about the support group. And it's important that those of you that are on the call that have the ability with Zoom and whatever right now in the midst of COVID, if we could create other support groups around that are going to help, just getting together. I believe in the CSI method, and it's community, systems, and individuals, where the community has its role, the system has its role, and then the individual has its role. Similar to what Crystal was saying when she tells her loved one, wash your hands, make sure you stay safe. That's his role. The system has a role to make sure that we keep those individuals safe and healthy. But then as a community, we have multiple roles, whereas we're creating support groups, we're making sure that they have a place to come home to. Like Heather was saying, making sure, Carlos was saying, resources. If we come together, we won't be losing people. We'll actually be helping people not only get out, but stay out. So these are the things that COVID has given us a beautiful opportunity to really come together as a community and help to create a safer space for individuals to be returning home from, not just in COVID, but all the time. People should be able to get out, stay out, and not be forced to. I can't even imagine getting out with everything being closed. You can't even get an ID. You can't get anything. And, we've been actually, trying to get gift cards to people who can't get food stamps right away. Tino, did you make it on the call yet?
Yeah, I'm on the call right now.
What's up, bro? How you doing?
Well, I'm listening to Deb talk about, the North 5 and 6, the Northern, and, it's important to always be able to be in a room full of people that would love to collaborate and have the open discussion about those that are continuous to be confined. But it's also important to be on these calls because I'm the one that gets the call from them dudes in all these different facilities, to have some input and some insight for them. Because don't just come from Chester, it comes from Northern, it comes from McDougal, it comes from Manson U, comes from, Infield, Carl Robinson, and them different facilities. But they need a face at the table that knows what's going on, because these are the type of people that they know they can count on. This is an issue of trust. This is an issue of belief. And they're actually seeing on the news and through literature and through documentation the Robin Porters of our community and the Jerry Smarts. I am on an alias today, but the alias wasn't on me. The alias was on the issue of getting this thing across. I'm still learning how to get familiar, how to use a phone. And the significant others, an administrator from another office in the other room. So I had to go in the cell and sit down and get into this call. But like I said, the important thing is for those that are continuously to be confined. The sad part is that they had to use Northern as a mechanism to transport these young men to this type of environment, because now you're dealing with the psychoanalysis that they have to deal with all over again, and they didn't even commit an act of violence. Most people, the most dangerous, have to be sent to a facility like the Supermax, and to be put on solitary confinement.
Tito, I'm so sorry. This is Brittany. I just want to ask everyone, please mute their mics. I can hear someone typing over you. So if it's a panelist, please mute your mic. Everyone, I can still hear the typing. And I just want to make sure that you are heard.
Thank you so much, Brittany.
Sorry about that.
It's okay.
I can still hear it. Everyone, please look at your mics.
But, I wrote some things down. I'm constantly writing things down. We're talking about assurance. I've heard Carlos earlier, and he was phenomenal today when you talk about those resources and, coming out of one of the major cities, the most populated cities in Bridgeport. I watched Dai McKnight, Fred Hodges, Kenneth Jackson, Lyle Jones become phenomenal fixtures. My issue and concern is always going to be, why is it that those that were formerly incarcerated don't get, allow themselves to be in these type of environments to get this information, but most importantly, to be on these panels where they can actually speak to those issues and concerns regarding, as they call, those concerns of those that are coming home. I served 30 years. I've been home 2 years now. You know what I mean? I love to be on these panels because I want the people that can make these decisions actually see that transformation is actually possible. I work hand in hand with Lisa Puglisi. And she mentioned something earlier that I wrote down real quick because it ain't about me, it's about the panel. But she mentioned something about, medical isolation, not solitary confinement. When people don't know how to make decisions, they make the wrong decisions. So when you have people that can make those decisions, get on these panels and see these ideas that are created by the folk that are concerned, or are they really concerned? Because our society's actually at the Capitol and expressing themselves in the pouring rain. I watched it on the news. I was sick. I watched it on the news. You got people in the pouring rain during the Easter holiday asking for those that are incarcerated to be released back into our community. So who's the ones that are actually having a problem by having them released? Those are the people that we need to have the conversation with. And I'm willing to raise my hand. Like I said, I had a life sentence. I served 30 years of incarceration. And some people constantly ask me, Tino, why you got to always bring that up? That's your past. That's never going to be my past. That's a part of my destination. That's a part of what I believe in. And that's this thing called prisons. People, not prisons. So we're really going to deal with dignity. Ask them folk to come talk to me, and I'll teach them what it means to navigate through this system about transitioning back into the community. But Brittany, you're doing a phenomenal job. Continue to bring the right people to the table, because if you bring the right people to the table, we're going to find some solutions over these problems.
Thank you. Look at Brittany glowing right now like it's her birthday. Hey, Tino, thank you, bro. I love you, man. I appreciate you being on the call. Stick around. We definitely want to talk more.
Birthday, there's a honey bun with some peanut butter on top.
You already know, man. Listen, I don't want to get into that. We're going to sidetrack. One of the things that I wanted to say that was valuable that you said, and I like to use this analogy. If you needed heart surgery, you would want the heart surgeon to be there. You wouldn't want the foot doctor to be coming to do the heart surgery. So when you need somebody and you're looking for an expert, when we're talking about reentry, you need to bring the people who have done successful reentry to the table so we can talk about what successful reentry looks like. I'm looking in the chat box and people are saying, well, what if they commit this crime? We can't control if somebody else is going to screw up. But I know one thing, if you talk to the right people, we could show people how to live after incarceration. And if you haven't done that, if you haven't experienced that, then you definitely need to talk to someone that has. Samara, are you on the call?
Hi, I am.
Did I say your name right?
You can hear me?
Yes. Did I say your name right?
Samaris.
Sorry, it's my birthday, so forgive me.
It's okay. Or you can call me Sammy. That's fine.
I like Sammy. That's easier. What you got? How you doing?
Okay. So I have my husband who's in Bridgeport Correctional. I have a cousin who's in Rogowski, and I have a cousin who is in Willard Cyboski, and I have a son who is in Cheshire. So for my husband, he panicked. He has severe respiratory issues, and he's in pre-trial, so he hasn't even been proven guilty yet. And he said that the COs in there are pretty much telling them that they're about to be on their own. Many are not coming to work, so those that are coming to work are having to look over more inmates than they normally would. For my cousin that's in Rogowski, he said things like everyone around him is walking around with symptoms of COVID-19, and they don't have any tests. He said if you have any symptoms, what they're doing is just quarantine you in this building that was down, that they had the inmates clean out, which we all know they already don't have enough supplies, cleaning supplies and sanitizer and all of that, but yet they had the inmates clean out this abandoned building that they had to store the inmates that have symptoms of COVID-19. Him himself, when he talked to me, he was short breath and he thinks he has it. And I told him I thought that he should let them know, but he's like, why? They pretty much told them, we're going to give you all a deck of cards and 2 more free phone calls. So to him, he said it was like they were telling him like, oh, you're getting ready to take your last breath anyway, and this is all we can offer. So he's been chewing on fish grease or something like that because he doesn't have a sense of smell or taste. For my son in Cheshire, it's pretty similar. So I think it was Deb. The stories are not that bad. It seems like it's pretty controllable at this time. For my cousin in Willard, he said that they're stopping the free phone calls. They're no longer going to be giving out free phone calls. This is the last week for them. And yeah, so it's pretty scary. All of them call and they're very scared and nervous that they're going to die in there. When I didn't hear from my husband, because I told him, you know, during this time, like I need him to call every day just so I know that he's okay. And I didn't hear from him for about a week, so I called his counselor and we had a pretty positive, we did have a positive conversation. And, you know, I told him how that he was in my prayers because they're risking their lives to come to work every day. Mm-hmm. But then my husband called that night and mentioned that they came and woke him up and was like, pack up, you're moving. And he was like, where am I going? They didn't give him no explanation, told him he had 5 minutes to do that, and they put him in a cell.
Wow.
So he thinks it's because I made a phone call. So now I'm just like, I don't know what to do. I've been doing a lot of advocating around this. I've been sending letters to the Attorney General, the Commissioner, Lieutenant Governor, Governor Lamont, and, you know, I reminded Governor Lamont that in one of his articles, he stated, now is not the time for people to be outside protesting, to just give him a call and, you know, he would hear from us. And even in that, I still have not received anything from him.
Wow, thank you so much. You know what, Samaris? Sammy, hold on. I want you to stay on the call because I got my good friend Robin Porter on it, and I know she's been sitting there, and I know she's ready to jump out of her seat. So
that's like my second mother. She knows me very well.
Yeah. So how you doing, Robin? Thank you for joining us.
I'm doing well. Can you guys hear me?
Yes, ma'am.
All right.
There you are. We can see you too.
Hey.
Hey.
The 33 behind me is for my son, whose birthday was yesterday, Daryl. So
okay.
I got two Aries men in my
Aries
life.
babies.
Aries.
I'm sitting here listening, and of course, what is being reported by the family members on this call is not exactly how it's being transcribed by DOC and their workers. So a request that I'm going to make, and Brittany, I will allow you to broker this, is to put me in connection with all the family members on this call so that I can actually get some more details around what is going on. But we have definitely had a call with the commissioner yesterday. The whole House Democratic caucus, he was on a call with us. And one of the things that was brought up was something, I think Lisa said it, I'm not sure, Dr. Puglisi, but somebody was saying we need more calls daily. We are asking for that. The commissioner stated that he would have his people talk with Securus to up the amount of calls because, frankly, Connecticut is way behind with what other states are doing in regard to those free calls.
Yep.
And I don't know if you guys know, but Securus is actually raping Connecticut when it comes to the rate of those calls. So Representative Elliott has been doing a lot of championing behind getting the calls to be free prior to this COVID pandemic. I don't know what to say. I do want to thank Dr. Puglisi for the phenomenal work that Yale Transition Clinic is doing. I'm definitely going to give you a call later on. I meant to talk to you yesterday about what happened with the inmate that concerns us because the reports coming from DOC straight from the commissioner's mouth to our ears is that this person was released was okay for release 30 days ago, and that his family actually refused to sponsor him. And now we're hearing from family members that is not the case, that he had two sisters that were willing to take him. And I think that's where my question around the relationship with DOC and Yale Transition Clinic is coming in, because the first thing that popped in my head, Lisa, was, well, isn't that the whole point of the partnership that they have with you all, in order to make sure that when we have justice-impacted people who are returning to the community and don't have sponsors, that they have that connection with you all, not just for the sake of medical purposes, but also for housing. I also stated on the call with the commissioner yesterday that, we need to be looking at the $5.9 million that you all are going to get for the criminal justice system. And I asked them to report to us how they plan on allocating those funds. And because housing is a tremendous issue, and has always been even before COVID, that they need to make sure that some of those funds are allocated to housing. I mean, we are actually putting homeless people in hotels right there in New Haven, and I made mention of that. Let's look at some of the colleges and universities, some of the dorms that they have. We can actually house these people safely and make sure that they're in an environment that is secure and actually has the wraparound services that they need to transition successfully back into their communities, our communities. And this has never been hard. I think what COVID is really showing is it's putting a light, it's shining a light on what was already wrong with not just Connecticut, but this damn nation as a whole when it comes to the way they treat poor people and Black and brown people. And with you on the phone, Lisa, I really would like to hear more about what we're doing to address the issues around the disproportionate impact of COVID and COVID death on Black and brown communities. Black people are dying at an alarming rate. Not that white people aren't getting it, they're just not dying from it. So would you be able to speak to that and what your clinic is doing to address that in that regard?
Robin, I can do my best. So I mentioned that earlier in the introduction, and I think it's critical to stress again for anyone who jumped on the call late that disparity in death rates is not shocking, not surprising. It's part of how our healthcare system is built, our entire insurance system connected to jobs and all of this. It is part of the American built system of really institutional racism. And so it is upon all of us to do everything within our power to combat it. So, at Transitions, what are we able to do is extensive amounts of outreach, employing Black and Latinx people to work on our teams so that there are people who can relate and sort of, it has been really well shown that people connect more easily sometimes with people who look like them, who have shared experiences with them, but none of that is shocking. And so it has to be part of the programs that we build. I'd also say that, we've been advocating at Yale that we can't be building testing systems that are prejudiced against people who don't own a car. You can't just have a drive-up system. That doesn't make any sense. How do people in our cities who don't drive or use public transportation go get a COVID test, right? This has to, again, it's sort of part of our built system of racism to just be offering tests to certain people who meet certain kinds of social criteria. And so, I think that's important. And then there's a big team at Yale. I brought this issue up at Yale that we have to be really intentional to make sure that our efforts are really extra focused on people who we know are disproportionately impacted. So there's a team led by this woman, phenomenal woman, Marcella Nunez-Smith, that is doing all work around sort of eliminating barriers. In terms of the correctional systems, we already know that we incarcerate Black and brown people at higher rates. So I think that part, a key sentinel part of us eliminating this racial disparity is decarcerating. We got to get people out. We already know that it spreads less quickly in the community and that generally people are safer in the community, able more to social distance. And so I think that I truly see depopulating our correctional facilities as a means to that end as well. And if it's okay, I just want to highlight two more things that have come to my mind in listening to all the amazing things people are saying is I can't underscore enough, and I always sound like a nut, talking like this, and I recognize that, and I really don't care, is that this is urgent, urgent, urgent. There's no such thing as overreaction right now. And so, I think that I can be criticized for sounding overreactive, there's no such thing. This is a public health emergency, underline, underscore, bold print, exclamation point, right? And so it's urgent. Like dealing with the 30 people a month who are EOS is good and necessary and not at all adequate. We need much broader scale and immediate changes. We don't have a month to 2 months to wait for these things. And so it's not business as usual, like not for anybody, not in any sector, like across the board. And so DOC falls under that as well. And so does our judiciary and everybody. So it is not business as usual. That's just not going to do. People will die and that will be our faults. And so this is preventable to some extent, and immediate action is necessary. The other thing I'll say is, again, like I said last time, an optimist because I have to be. Like, this work is too long and too hard to not be optimistic about it, is that we have to believe in our own powers, potential, and creativity and what we can solve together. There have been creative ways that people have gotten each other out of harm's way since the beginning of time in this country, right? And so we need much more creative solutions around housing. And what is this term, like sponsorship, right? Like, let's be more creative. Maybe it's some sort of other community monitoring while being housed in the thousands of empty dorm rooms in our state. It's sinful for them to just stay empty and not be housing people who need to get out of correctional facilities and don't have anywhere to go.
Right.
Not using them is inadequate. And very, very last, sorry, Daryl, just to out there for the advocates is like, the DOC health system was understaffed on a good day before all of this. That has been widely reported, right? And that's not their fault. It's just what it is. Like, this is just like the facts and the reality. Now you get people sick and you have staff members who are also being affected by illness. This is going to be a humongous health crisis in the DOC. And we have to call on our community health system to step in there. Like, that's not allowed to be a black hole. Like, it's just not acceptable. And so we need DPH like intimately involved and other people as well, because we're going to have to be getting people in there to staff the health needs of people who are sick and incarcerated. And let me tell you, from dealing with lots of patients who have had this now, it's a very scary illness. You feel sick, like you're going to die for 2 weeks. Like, that's not a comfortable feeling, being isolated in a cell with inadequate medical staffing. I'll leave it at that.
I appreciate that, Dr. Puglisi, and everybody on the call. I know we lost a few people, and it's interesting when our impacted people and our family members start to talk, people check out, and that's when you're supposed to really check in, because these are people that are directly connected. I really appreciate when the doctor clearly says it's urgent. You know, when the doctor says it's urgent, I mean, we should be listening up. It's not time for a political chess playing with people's lives. I appreciate everyone that was on the call. We're going to move to just our last segment. I believe that Brittany has a couple of other members of the Black and Puerto Rican Caucus that are going to jump on, and we'll meet with them, and then hopefully have a couple minutes to close out. And keep sending your questions to our chat box. We will try to answer them any way we can. We want to make sure that people know about those support groups in the community. And we also want to make sure that you're checking the IMRP website as well as the Reentry website on DOC. We have a line for family members to call. I'm fielding a lot of those calls, so if you call, you might get me. Not today because it's my birthday. I'll be making a jail cake later. If anybody's interested, catch me on Facebook. I will be making a jail cake with my daughter, my sous chef. So we're going to move to Brittany. Who else do we have?
Well, I'm working with State Rep Chris Rosario. He's trying to get on right now, but unfortunately, we're having some technical difficulties. I don't know if you want to check back with State Rep.
All right, cool. You let me know. Hey, Kev, did you make it on the call, Kev? My friend Kev did not make it. Kev was recently released within a week ago. He had just came home. We want to make sure that we, shout him out. And
Yes,
those
I would
names.
love to hear from him, Daryl. I mean,
Yes, we'll make sure that we connect him to you, Robin. You're
yeah.
like everybody's second mom. You know what I mean? So we really appreciate, the work that you do. You and you and some of your colleagues. I'm not going to say all, but some of your colleagues really fight this fight. And we got a lot of advocates that are in the street, going to the governor's house and doing those things. But if I can emphasize more or ask, what are we asking for? We're saying release everyone. We know that's not possible, and people laugh at us when we say things like that. We want to make sure that people understand who we're asking to be released. If you were on the call earlier, you heard Sarah say those people that could be released and the mechanisms that they could be released. So hopefully many of you are taking notes. If not, this is being recorded. We could go back and really start to line up what our asks are, realistic asks, like saying, using the dorms. That was one of the first things. Dr. Puglisi was on the calls early. We haven't just started making these calls. We were on calls weeks ago talking about utilizing the dorms, and they have been utilized, but not for the people that we're talking about today on this call. So how we doing, Brett?
Well, we're still having technical difficulties. So in this moment, though, I just want to, as we wrap up, I want to plug our hotline for the Connecticut Reentry Collaborative. I'm going to be sending some information about that. But for people who have a pen and paper, the phone number is 203-699-6316. So if you would like, if you're a family member or a friend of a person who is incarcerated and going to be getting released, or you have some questions or concerns and you're not getting answers from DOC, please feel free to call that number and we will connect you with a member of the collaborative.
Also, I think we wanted to talk about, once we heard the idea that individuals that were sick were being transferred to Northern, we decided to add another series called Film Fridays. And one of our first is going to be showing The Worst of the Worst, I believe the film is, and then having a talk back about that. So stay tuned. Those of you that are registered will get an email, and we'll also put flyers out for our Film Fridays and actually have panelists that were in Northern. We may bring Jerry Smart, aka Tino Grown, back in reference to that conversation, and maybe some other people. But we definitely want to stay connected, and this is something that we're all very passionate about. And I really appreciate everyone's expertise coming on this call, and those of you that stuck with us the whole time. This is something that we need to continue these conversations, but having these conversations and figuring out how we can come together. Brittany, did you get our friend on, Mr. Rosario? No. Okay.
No.
Well, we apologize.
Can I jump in real quick though before you go?
Absolutely.
I just want to talk about one thing because as a legislator, we're getting a lot of we're waiting on federal funds. And this is not something I'm just saying because of COVID. This is something that I've been saying since I've been doing this work. That and not that we shouldn't ask this system that was designed to do exactly what it's doing, to be dismantled and rebuilt in a way that is equitable. But what I'm saying is, in the meantime, in between time, we really are going to have to take this to a grassroots level, back to the basics, back to being a village. And I've been getting this in my spirit for years, back to the basics. You got to get back to being a village. We're going to live together. We're going to die together. And this is how I'm feeling about COVID and what it is really exposing to the most vulnerable communities that happen to be Black and brown or poor white people, just folks without funds and access to political power and money. So I want the advocates to think about going forward, and myself and other legislators as well, everybody, about how do we build community, how do we build village, how do we take a look at the things that are how communities are being disproportionately impacted. We have the fear of families not being able to eat, right? We have undocumented workers who are not qualified for unemployment. We're fighting for that. I'm the labor chair. I'm pushing for that. But in the meantime, food pantries are running out of food. People, the health disparities that Lisa spoke to. I want us to really start to brainstorm around how we build our own, for lack of better words, government, right? A political body that will govern in a way that is going to take care of the ones that need to be taken care of. So I just want to put that out there because it makes my belly ache every day I get up and do this work to see, as hard as we're pushing it, as much noise as we're making, especially Senator Winfield, around, you know, this incarceration and DOC and NORT and everything that's going on, and all the people that could be released that are not being released, right? Let's think about, you know, the ways that we use the power that we have to get done the things we need to get done. Because, Lisa, you hit it on the head, and I've been saying it. This is urgent. They keep telling us to wait, and I'm like, we don't have time to wait. People are dying. We don't have time to wait. Wait on what? For more people to die? And guess what? The people that are dying they look like me. Like, let's be real. It's time to fix the problem. So I just wanted to throw that out there real quick to you all while I had your attention. But I really want us to start looking at a strategy and a plan to build from the ground up to take care of the people that are on the ground. Because when we lift from the bottom, everyone is elevated. Thank you.
Thank you, Rep. Porter. I knew it was going to be something when you showed up with your hoodie on. I
just want to chime in, Daryl. Chris Rosario is now on the line.
Oh, okay. All right. So welcome, Chris.
Thank you.
Chris, you're on.
Yes.
Hey guys, how are you guys doing? I pray everybody's safe and well, and your families are well. Thank you for having us on our call. And it's a hard act to following Rep. Porter, but we know we're all in the same fight. We've been on the front lines, you know, asking DOC commissioner and the governor questions directly of how do we take care of our communities, especially those that are incarcerated. These impacts are not impacting the people that are incarcerated, but also those that are back home that are care for them. As many of you know, my brother's incarcerated. He's at Cybulski. I talk to him daily. As a matter of fact, I was just on him before joining, on the phone with him before joining this call. And one of the conversations that I said last night in our BPRC meeting and this morning, he's telling me that there's some inmates that are suffering from symptoms of COVID, but they're afraid to say anything because they don't want to go to Northern. And for most of you guys, especially those that have been incarcerated, you know, if you're at a level 1 or level 2 facility, and that means you're around the corner, you're turning that bend, you're almost home. And to go to a level 4 facility to suffer in a small box, they'd rather suffer, you know, in their cells and in their bunks. But that also creates a risk because now everybody else is going to get it. So I've been instructing the DOC commissioner to provide more safety measures, more N95 masks for his staff they're the ones that are coming in and out of the building. So it's for their safety and also inmate safety. So and I know we had a call this morning with the governor, and I had asked him to cover the expenses of Mr. DeLeon, who passed away. I'm like, he died under your care. Right. And now you're gonna stick the family with a $1,400 bill. There goes your Trump stimulus check. Right. You know, so there's a lot of things that you know. Where you can prepare for a snowstorm, you can prepare for a hurricane. You can't prepare for a pandemic. In many cases, you know what? We were prepared, and in a lot of cases we weren't. And when it comes to handling with people with criminal justice, they failed, in my opinion. So I look forward to continue working with Rep. Porter and my colleagues on the Black and Puerto Rican Caucus, and with the advocates like yourselves to move the needle.
Thank you, Chris. We really appreciate that. I mean, that lived experience that you just brought to the table was valuable, to actually have a loved one that's in Cybulski that gave you. We had some other family members that are on the call that also heard you say that, you know, to say that, you know, that people are scared to go to Northern. I know myself, having been incarcerated, and I was in a level 2, Northern's a level 5. There's no way I'm telling anybody, if I'm in a level 2, almost ready to go home, if I die, even if there was a slight chance that I might be shipped to Northern, I literally would be coughing in my pillow And I know that people that were surrounding me, because when you're inside, prison is a community, and we look out for each other. So those people, would be looking out for, I'm sure they're looking out for each other as the best as they can. And in respect to time, we are about to close, but this does not end the conversation. This is, Brittany, did you have a couple of things that you wanted to say on a chat line or anything before we wrap?
Well, anyone who would like to be connected with State Rep Robin Porter, as she mentioned, she asked me to connect you all. So please feel free to email me. My email is Brittany, BRITTANY, Kane, KANE, at CCSU. If you registered, what I will do is I will follow up with all of the supplemental materials that we were talking about today in case you weren't able to access, and including, I will also send the hotline information again.
If I could just briefly add just a quick PSA,
Absolutely.
if you don't mind.
Yeah.
Many of our families, we're hurting on the outside, but you got to remember on the inside as well. If you have a loved one, please throw a little extra dollars on their commissary, on their books, because like you said, they're not getting visits. They're only getting the 2 phone calls, which we're fighting to get more phone calls. But also you're trying to protect yourself. So the more folks that you can go in that commissary and get a little extra food, that way you don't have to go out into Gen Pop and expose yourself. Throw a few extra dollars to your family's books.
Thank you for that. And I actually, Andrew, I know is going to be wrapping up, but Andrew, I just want to say while you wrap up, that might be a good segue to mention the Emilio program as well. That can help out right now.
Can't hear you, Andrew.
Aha, I'm on.
Everyone, please shut off your microphone.
Reentry Day shirt, Robin. I was adhering to it too much. So thank you, everybody. Can you hear me now? Fine.
Yep.
Yeah.
So I want to thank Dr. Puglisi, Sarah Russell, Earl, Carlos, Heather, Daryl, Deb, Crystal, Kevin, Rep Porter, Rep Rosario. Thank you so much, Brittany, for everything you've done. I also want to thank the CCSU IT people that make this happen for us. Rep Porter, Rep Rosario, please let folks know in the legislature if you want to use our platform, if you want to hold a meeting. I don't think there's anything holding you guys back from holding a meeting. I know the legislature is not in session, but you're always welcome to use us. And we can help that happen for you. So
we can offer my services.
Thank you. Appreciate that. You guys are doing a great job.
Well, thank you. As you say, everybody's in it together. And I think Rep Rosario had a great point there, too, about the commissary. And I know Emilio.org, AMEELIO.org, are some folks that came out of Yale and started a free app for letter writing as well. And so you just have to go on there and they're sending letters into DOC and it's unlimited. So
can you repeat it again, please, Andrew?
AMEELIO.org. I also posted it in the chat room as well. So, and for anybody that hasn't been to Northern, A, you're lucky, but B, I had a tour there about 3 months ago, and I walked out of there just dumbfounded by why that place still exists in the state. It was created in the height of the tough on crime. It's a super max. It's meant to tear people down, including staff members. When I asked there, was there anything in there that was set up so that staff members have any bit of solace? The answer is no. We don't believe in that mantra anymore. There's no way what symbolizes that should still be around in the state. And for those who haven't seen it, we are going to do Film Friday. So this Friday will probably be in the morning. We'll send out information about that's a 30-minute video the Yale Visual Law Project did. We'll do that in the panel after, probably through this platform here. So we'll send that information out and probably do some others all through Second Chance Month. Again, this was our planned reentry day, reentry reform day at the Capitol. We had it virtually, and you know, this brings light to the issue in ways that we had never imagined. But the urgency is there. Opportunity is also there. And so let's make the most of that for the people that are impacted, for their communities, and look forward to hearing from us more. If you have ideas of things that you'd like to hear about, please do. We do appreciate people being on and a little longer than we had anticipated for. We know you have to go off and you have other things that you need to do. Please know that we are videotaping this, and that will be available. We also had channel 61 Fox News participate, potentially the Connecticut Mirror, and so look out for those stories, and we'll send you that as well. So thank you so much for participating today. I saw a lot of familiar faces on the attendees list. Thank you so much, and let's keep this all up.
Thank you. Thank you. Bye, everybody. Thank you.
Bye.
Thank you. All be
Thanks,
safe.
everyone.